I am Anthony DiPolito from Northampton County, 2nd District. I am here, I want to take this opportunity to nominate Denai Powers for Vice President of the Pennsylvania Medical Society. Initially having trained at the University of Pittsburgh, Dr. Powers subsequently started a transplant anesthesia program at Emory. She returned to Pennsylvania and has practiced anesthesiology for the past 24 years. Dr. Powers has served our society from the 6th District on multiple levels. She has served on the Council on Government Affairs. She was on the Committee on Subsidiary and Foundation Relations. She was on the Task Force on Continuous Professional Education. And as a liaison, she served to the Political Advocacy Council. Dr. Powers has, like I said, been on the 6th District trustee since 2010. I am nominating Dr. Powers because she has shown herself to manifest the leadership, tenacity of purpose, and necessary skills to guide our medical society and our profession through the turbulent waters ahead. We are at a critical time in healthcare in our nation, and it's important that we have leadership that is willing to make the hard calls, address the tough issues, and lead physicians and patients we serve to a better day. VA-Med has a great opportunity to bring physicians together. To do this, we need a leader who will support the whole, restore the patient-physician relationship, begin the steps necessary moving toward a new healthcare system that is patient-centric. We cannot continue to accept every mandate silently with no pushback, hoping that things will change. Dr. Powers has consistently provided a superior level of service, has demonstrated an extraordinary spirit of being a team leader. As we know, healthcare is under siege. More doctors are being employed. Some are made private practitioners. Dr. Powers will be the best suited to bridge that gap and guide our ship into the future. In a state of Pennsylvania that's so big, it is sometimes difficult as a board member to not become self-serving and distanced from the problems of the members of. We need a leader who will address these non-clinical matters that divide us. Dr. Powers is that person who has the intellectual clarity necessary to lead us through this quagmire. I thus nominate Dr. Powers for the Vice Presidency of the Pennsylvania Medical Society.
Thank you, Dr. DiPolito.
All right. Good morning. I want to share with you my perspective that I will bring to the position of Vice President of the Pennsylvania Medical Society. I'm an anesthesiologist and started practice in medical school and trained to be an anesthesiologist. I began in the 1970s. And since then, I've worked in academics, research settings, teaching, hospitals, transplant medicine, urban and rural practices, and I'm currently in private practice. I've seen a lot. I've watched the number of doctors about double and the number of administrators go up about 10 times. Based on my experience, I can tell you that I have concluded that if we are truly pro-patient, we must be pro-physician. There is no other profession that is as capable and qualified to heal sick people. But sadly, so much of what has happened to medicine over the past decades exemplifies the saying, there is no problem you can't make worse. Let me present a revealing story. At a recent hearing of the Pennsylvania legislators where pushing for the independent practice of CRNPs, Michael Young, the CEO of the Pinnacle Healthcare System, stated, and I quote in part, "With all due respect to the physicians, at Pinnacle Health, I lead the team." I wonder how Michael Young would feel as the head of the healthcare team if he was also personally named in the next lawsuit against a physician at the Pinnacle Health System. Think about this. Physicians bear the liability for adverse patient outcomes, but others take the credit for what we do and push the idea that they are the ones in charge of medicine. These same individuals are nowhere to be found in the ED at 3 a.m. with a sick child. They're not trying to squeeze patients into an already too full office or operating room schedule. And they're not waiting months for a day off because their practice is so short-staffed that taking the time would compromise patient care. We must vigorously correct this narrative. Our reality is that bureaucrats, administrators, insurers, and other non-physicians haunt every one of our steps. We use years of training and devotion to deliver care to patients, and at our shoulders stand a legion of micromanagers profiting from regulations they create and doing nothing to improve patient care. The philosophy that we first must accept a very bad idea and then try to mitigate the damage is a losing proposition. We must unwind onerous burdens already in place, educate legislators and the public about the damage that is being done to patient care. PA-Med must be the strong, proactive voice that pushes back. We must confront the Hospital Association over detrimental policies. We must protect all practice options for physicians, private, small group, large group, and hospital employed. It is this competition of practice options and the ability to choose that will protect access and quality for patients over the long term. We must expose that manipulating doctors delivers poorer quality care at greater expense. There are those who know this but love putting the money in their pockets and then blaming physicians for the increasing costs. Legal associations protect attorneys' rights to control the practice of law. If lawyers control the practice of law, surely it is even more important that doctors control the practice of medicine. PA-Med is our association with which to do that. We cannot leave it to individual physicians to fight this alone. It's late, but it's not too late. We must do a better job of turning PA-Med resolutions and priorities into legislation. In my 7 years on the board, PA-Med has introduced few legislative initiatives, while our staff is overworked dealing with a deluge of legislation against us written by other stakeholders. We must be more strategic with our resource use. How about increasing financial and personnel support to grow legislative impact? Imagine banning contract language that places the interest of a hospital or insurer above a physician's right to advocate for a patient, or requiring the insurer to bear the responsibility of paying deductibles when patients do not. PA-Med challenged MOC and exposed fallacies, conflicts of interest, and monetary motivations underlying a tale of concern for quality. Success will breed more success. We are an ancient profession, highly trained, intelligent, respected, and with a work ethic that is almost suicidal. We can do this. Things can improve. If elected, I will work to get us there. Thank you for your time. Thank you for your attention. And for something you don't hear enough, thank you for your service to the patients of Pennsylvania.
Thank you, Dr. Powers.